Morgan. She's a medical expert and the Vice President of Medical Affairs at Hello Heart. Dr. Morgan, thank you so much for joining us today. Look forward to hearing what you think about all this because RFK Jr.'s nomination comes as less children are getting vaccinated. KFF, I wanted to ask you about this. It's a nonprofit group that researches health policy issues, reporting that less than 93% of kindergartners had received their state-mandated vaccines in the last school year. So as we take a look at all of what could be ahead for RFK Jr., what kind of effect do you think his vaccine policies could have here?
One of the effects that we've seen, and it's such a great question, with regard to really throughout all of his years of leading an anti-vax campaign, which really has been cloaked as a vaccine safety campaign, is that it creates confusion for the American public. And what happens to human beings when there's confusion? Inertia develops and we simply do nothing. We are frozen and we don't know which messages to listen to. But here's a person without a scientific background. And the way this began is in 1998, Andrew Wakefield published a paper in Lancet that demonstrated that autism was related to vaccines. That paper was not only refuted, not only shown to have gross negligence and multiple errors, not only was it retracted, but it was actually determined to be fraudulent. So an incredible categorization of this paper. But that fraudulence wasn't actually formalized until 2010. And so between 1998 and 2010, so much damage had been done in creating all of this uproar and confusion that is what drives what is happening now. And this is what we are seeing with regard to whether the Americans are interested in vaccines or not.
You know, I'm glad you brought that up because I've talked to a lot of moms about this, and people are really confused at times. They're not quite sure what to do, especially as newborns. You know, reports that RFK Jr. has shifted his stance on vaccines to get confirmed. Do you think that he should be the next health secretary? What are your thoughts?
I don't think he should be the next health secretary, director of health and human services. He's unqualified. I'm certainly a better candidate than he is if we actually are wanting to look at scientific credentials and someone who is steeped in science to be over the CDC, the FDA, and the NIH. When we look at vaccines, not only are they not related to autism, it's also, you know, this conversation of whether natural immunity is better. And certainly natural immunity is a path that people can take to get immunity, but it also involves a lot of morbidity, meaning illness. And we also, as an American public, have to be able to tolerate a certain amount of death. Death comes along with natural immunity. Vaccines prevent these types of occurrences, and we probably don't remember death. But even back in COVID, after vaccines came out, there were another 300 to 400,000 people who died who refused those vaccines. In science, we call those needless deaths. But the fact of the matter is that most of those lives could have been preserved with vaccines and not going the natural immunity route. Natural immunity is effective, but it requires a tolerance of a certain amount of death within the community and within society.
I got to ask you, just talked about your qualifications. I mean, would you want the job? And if you don't, would you consider being a part of this administration? Would you consider helping out? Because I'm wondering just how much outreach there is with people in the medical community for RFK Jr., you know, who, as he gets ready for this next potential role.
There's little support for RFK within the medical community. And I propose that really tongue-in-cheek just to show what the stark contrast is between the medical and scientific community who devoted our careers to science and education and someone here who has an agenda that is steeped in a paper from 1998 that has been determined to be fraudulent. And so these are really great concerns. And we look at the committees that really decide our safety and our health with the CDC and the FDA, including our immunizations committees, and the types of people who are being perhaps identified to be on these committees who are anti-vaxxers, that's actually the antithesis of what the committees are supposed to be. They are not supposed to be steeped with people with agendas. They're supposed to be steeped in people with scientific background and integrity who are analyzing the data independent of agenda and deriving conclusions that are for the safety of the American public based on science and based on data, not based on agendas that are trying to be driven. And so, by and large, the medical community is not supportive of this RFK nomination.
You know, RFK Jr. pushed for the debunked idea that vaccines cause autism, as we've been talking about, but he has more recently insisted he's not anti-vaccine, but thinks they should not be required. So how important is it for vaccines to be mandated when you take a look at that and take a look at the words on the screen of his shift?
Yeah, but the damage is done. It's not so much of, in society now, we don't necessarily have to prove anything. We just have to create doubt and sow confusion. And then all of the dialogue begins, and people begin to run down this rabbit hole. And he's been very successful in sowing confusion. And when we look at vaccines in particular, and if we want to talk about autism, let's talk about autism. The spectrum of autism has increased over the last 20 years. In other words, the diagnoses of autism. So there used to be only a few diagnoses. Now there's an entire spectrum. So more people are included in the diagnosis of autism. Additionally, more females are diagnosed. Generally, only the males, because of our patriarchal society and even patriarchy in medicine, males were more often identified with autism as opposed to female children who were tended to be considered to be mercurial. And these are just female traits. Now we're enrolling more females. And so what is happening? We have a larger number of people being diagnosed with autism because we have greatly broadened and expanded that definition. And so these are a number of things. This is just basic science. This is basic science 101. These are the types of things that we need to look at, in addition to the plethora of other things that are going on in our environment at the same time as autism rates increasing. He picked one thing, vaccines, but in effect, we have pollution. We have we have all kinds of things going on. And so this is why the medical establishment, by and large, is not supportive of his nomination.
Dr. J. Morgan, I've got to leave it there. That's such interesting perspective. I appreciate your time, and thank you for joining us. We'll check back in, especially after we get past this week, okay?
Thank you.
Thank you very much.